Hello, everybody. So welcome to our second session of today, which is going to be a recruitment spotlight where we're specifically delving into talking with our conference sponsors, such as Cerevel, and really just looking at how we recruit Black talent and what steps they are taking, what is being done on their front, but also just having a frank conversation about the sort of skills that are needed to exist within the industry and within these spaces. So as a quick intro, my name is Deshane Murray. I am the Development Director of Black in Neuro and now final year Neurotechnology PhD student at Imperial College London. And essentially today, before we start, I really want to thank our generous conference sponsors, without which these events would not be possible. So a few announcements again, we have live captioning and American Sign Language interpreting, which are available for this event to turn captions on or off. The CC live caption icon is there along the bottom of your window. You can also adjust the size of the front by clicking on the three dots at the bottom of your window that say more and select subtitle settings. Our sign language interpreter deploys who has been absolutely exceptional again this week, it should be pinned directly on your screen. And if you have any issues directly, please contact us and we'll get it sorted for you. So before we begin, again, I would like to acknowledge the fact that the work of Black in Neuro primarily occurs on Turtle Island, which is also known as North America, which is home to a diversity of indigenous peoples. I encourage you all to take the time to reflect on the lands we inhabit. I too have done this, and as a proud Jamaican, I also recognize that the land my ancestors came to inhabit as enslaved persons from West Africa originally belonged to the Taino people before the Spanish invaded what is now known as Jamaica in 1494. So our struggles and our history, they are intertwined, and we must not forget our past as it informs our present and our future. And last thing for me is that all sessions from this week will be available via our YouTube page at Black in Neuro, including this one. And additionally, if you want to share any highlights from what you learned today on social media, please do so using the hashtag Black in Neuro Week 2021 or hashtag BINW21. And today's hashtag is Black in Neuro Careers. So with me today, I am joined by Isaac Bloom, who happens to be a principal sourcer in talent acquisition at Cerevel Therapeutics. So in his role, he's really responsible for developing and implementing recruitment strategies to attract diverse talent for Cerevel's growing ranks. So in the past 2 years, Isaac has helped hire talented individuals across multiple functions and a broad range of roles, from VP of medical affairs to summer interns. He is passionate about building teams that are focused on changing the landscape of CNS, and driving critical medicines to patients in need. So welcome to you, Isaac.
Thanks so much, Shane. It's a real pleasure to be here.
Great. So we're really going to just get straight into it. And probably for those who have just joined for this session and were not in the previous session, if you don't mind, can you give us a little intro into what Cerevel Therapeutics actually is as a company?
Yeah, absolutely. Well, Cerevel Therapeutics, we've been around for about 2 years, so we're a younger company, but we have a mature pipeline. We inherited the Pfizer's ex-CNS portfolio. So Pfizer had been working in CNS for decades, developed this robust CNS pipeline. However, the CNS work didn't fit into their overall business strategy, and they ended up not necessarily a spin out, but they ended up partnering with Bain Capital to create this standalone independent entity that's now become Cerevel. It's an amazing company. We're literally a mid-market company in startup mode based on the size of our portfolio and the number of employees we have. We're just about to the Dunbar rule of 150 employees. That's just been a remarkable journey. Actually, yesterday was my 2-year anniversary with the company. And I just feel really lucky to be part of such an amazing organization. led by our CEO, Dr. Tony Coles, and our president, Abe Cisse, who was just terrific as a member of the previous panel. So Cerebelle, we're growing. We're based in East Cambridge, Massachusetts, the other Cambridge, and there's a lot of momentum, a lot of energy. We're really excited, and while being cautiously optimistic about our portfolio. I mean, CNS, as everyone on this call probably knows, is a challenging space, but the future is bright. We have amazing leadership. We're always looking for fantastic talent, folks with a real passion for CNS and making an impact on not only the patients, but also the caregivers. You know, being a caregiver for someone who's suffering from Parkinson's or schizophrenia, these are difficult times for everyone involved. Just to give you a sense, we're really an R&D focused organization at this point. We have a phase 3 asset called tavapadon. We're going through global clinical trials, and we're, again, optimistic about the science and a path forward, but you just never know. That industry is a topsy-turvy world, but the risk versus reward is amazing, and it's such meaningful work. We also recently had a positive top-line readout for our phase 1b schizophrenia asset, which could be a real game changer. So there's a lot of activity, a lot of excitement, and ultimately, in terms of the growth of our company, we're being very intentional and very focused on broadening the our diversity within our employee ranks, and have made commitments to really develop, support a diverse community within our organization. We're not only interested in supporting the molecules and translating them into medicines, but we're also into developing talent and supporting the folks within our organization in terms of achieving their individual professional goals.
Thank you. So it's a great intro, but we're going to go into one word you said specifically, which is talent. And obviously we're here with Black Neuro, we're interested in promoting Black talent. So really the question is, what is Cerevel doing to attract Black talent?
Yeah, well, again, I feel like we have a long way to go in becoming an ally. And I feel like, you know, I come here as someone who wants to be an ally, who's moving towards allyship. And that's, it's more than a word, and it's actions. It's consistent, consistently showing up, and not just a line item in our, you know, corporate goals, right? We are looking to really establish and engage diverse talent, specifically Black talent in neuroscience. To that end, you know, it is part of our overall corporate goal. And we are looking to add at a variety of levels, and specifically senior levels, leadership positions, because what we feel like we need to raise the bar. You may see in a lot of companies that there may be diversity along certain tracks. Well, we want to break through that ceiling and create a community and an opportunity for folks in leadership to mentor and bring folks forward into more and more roles with more and more responsibility and influence over the company. So that has to do with talent. It goes beyond in terms of our suppliers, our preferred vendors. We want to open up and continue to expand our sphere and really draw people in. I mean, the strength of our company lies in the diversity of thought and inclusion. We will be, you know, as we all know, we are our own limiting factors oftentimes if we have our blinders on. So we want to encourage individuality, authenticity, and bring together, again, a diverse array of talents to help us fulfill the promise of these molecules, and to build a community that will have lasting meaning and give back to the community as we move forward. Yeah, and so in terms of, we're being intentional. So we want to be part of this conversation. What an honor to be here and have this dialogue. And I'm here as a resource. Obviously I'm pitching Cerevel, but because I feel so great, so lucky to be part of the team. But I want to give back, provide any insights I can in terms of transitioning to industry. We've actually, we've created engagement with HBCUs, and we're looking at establishing long-term relationships. I mean, this isn't necessarily, we can't necessarily snap our fingers and have change. We understand that this is the long game, but we want to be at the front of this initiative.
Most definitely. It's great also. So I guess we'll probably go directly into those skills, and as many of us here at Black Neuro, we're academics by trade.
Yeah.
So what skills would you say that in your profession that you're looking for those of us who are looking to make that transition?
Great question. I mean, it's such a tough one, because the first skill would be perseverance and resiliency. I mean, it's as a recruiter, so I'm out there actively recruiting, looking for the top talent for particular roles, again, across the organization. And what I often hear from hiring managers is, I'm looking for someone with industry experience. Well, then I talk to an upcoming rising star who has an academic background, and they're saying, I want to get into industry. So you reach that inflection point where something's got to give. So part of my role is to also, so if you're having trouble breaking into industry, you're not alone. Okay, you're not, and keep going. There are lots of opportunities to get involved with clinical studies, right? It's the clinical development component that is really attractive to a company like Cerevel and other biotech companies. So as we're in startup mode, we have a lot of senior, sort of seasoned leaders who have been through a lot throughout their careers. So we typically, are looking for experience as well, folks who can come in and hit the ground running. Now, if I set my Cerevel hat aside for a second, I've worked for companies like Biogen and Genentech, who are larger organizations. Sometimes they often have the bandwidth to have, to train and to ease folks into it. So it's not uncommon for folks transitioning from academia who go into industry to go into a larger company, get the training, earn their chops, right? Understand the process and the business, and then to sort of go, well, I want to build something too, and then migrate over to a smaller company. Now, this isn't to dissuade anyone on the call from checking out Cerevel, because we are growing at a significant rate, and there are opportunities here as well. But what we're looking for is a commitment and passion for science in more of the technical track roles. But I'll tell you, the biotech industry, if you take a broader view, there are thousands of opportunities, thousands of jobs, not all in CNS, but can really leverage your training. If you're a PhD or a postdoc or an MD, I mean, sky is the limit in terms of opportunities in biotech and pharma.
Wow, thank you. So going to go into something very specific. So you and I have had various conversations in terms of the partnership that we began to build with Black Neuro and with Cerevel. But I want to talk about a few quick wins, quite specifically, and just what you've done in response to our work and really bringing us together as Cerevel and Black Neuro. So specifically on something that Abe mentioned in the careers panel, which is on the undergraduates which you've recruited already from our profile. So can you speak a little bit on that and what led to that process?
Yeah, absolutely. Well, really, it was it started with our CEO, Dr. Coles, who has close ties to historically Black colleges and universities, and is really always talking about his philosophy of service and giving back, and being a beacon of hope and a mentor to the next generation of neurosciences and folks who are interested in biotech. And so we kicked off our inaugural summer internship program, specifically interested in folks from HBCUs. And I had looked at BIN earlier on in the year, and we didn't know how the program, like anything, Shane, you probably know from last year's conference, you just don't know how these things are going to jump off. So we didn't know if the HBCUs would be interested or how, what the level of interest would be. So I reached out and I started checking out BIN on the internet, and just was amazed at the collection of talent and the community that was growing out of BIN, and all the issues surrounding racism in America and the need for equity and equality across multiple disciplines. And it's something that I'm very passionate about as well. So I started poking around and reaching out to folks, and we had two members of BIN accept an paid internship role with us, Eden and Illumide, and they have just been, the feedback on our internship program has been nothing but positive. So again, we've come up with a concept. We say we want to do X, and then we have to execute the plan. And so BIN has been a great partner in helping us really create a rich and robust experience, not only for, I think Eden and Illumide are probably teaching us just as much as we're teaching them. So it's just been an amazing exchange.
Perfect, thank you. So it looks like we have a question in the chat. So
awesome.
I'll read it out to you. So it says, hi, good evening. So regarding the internship and general recruitment, what are your requirements, and is it open to only those in the USA? So then with a previous of what are the chances of those in Africa getting recruited?
Absolutely. So right now, I would say, this was our first year of doing the internship program. And so we did focus on the US undergrads, but it will be interesting to see how this program evolves based on the success of this initial cohort of interns coming through. I wouldn't be surprised if we started to broaden our reach. Admittedly, our focus right now is building out our US presence, but we are starting to move into say Northern Europe, and I anticipate other continents, including Africa, would be part of our area. I know that so I mean, again, we're in a startup situation. So, and even though we haven't been around a super long time, we have demonstrated a strong tradition of being anti-status quo, kicking down boundaries, and so I wouldn't rule it out. If you're interested, let's stay in touch. To the questioner, happy to chat.
So we have another question that's popped up in the chat actually. So it's, what is your advice for recent graduates thinking about going into industry as a full-time employee?
Well, I would probably try to want some context. Now, have you recently graduated with was it an undergrad degree? Do we know?
Bachelor's, yes, it's undergraduate.
As a father of a couple of teenagers, and I would say go to school. Education is the key, right? There are opportunities at a bachelor level. However, there does seem to be some limitations in terms of your professional growth. A lot of companies, and I wouldn't say Cerevel, again, we're new. Not a lot of folks are even getting promoted yet because we're so young. But in terms of promotion and leadership track and management track, I would definitely encourage a master's, PhD. I would max out your educational opportunities so you increase your value, your desirability. Again, there are lots of other jobs, but if you want to be a game changer and a player and lead teams and really maximize your potential, I would definitely encourage you to stay in school as long as you can. I hope that helps.
Thank you. So let me go back a little bit. So I'm just going to ask this question on ensuring about your workplace in terms of environment. So one thing, especially with us at Black in Neuro, and just with me in development, is making sure that, okay, we've got this communication that's going between, say, ourselves as a nonprofit and then a company, but making sure that whoever is getting recruited are actually ending up in environments that actually benefit them. So can you speak to that and just what you see that's happening at your workplace to make sure that there is an environment that benefits everybody?
Yeah, absolutely. I think one of the joys for me in working in biotech is there are incredibly smart people in this industry. I mean, we are talking about what I feel are the best and the brightest folks who are putting their heart and soul and energy into developing medicines that will change people's lives. But that's not to say that there isn't racism or ignorance, right? So what have we done as in response to knowing that this is just a fact, right? And we need to continue to educate, continue to fight for equity and equality. One of the tools that we've used is the Posse Foundation. I'm not sure if everyone on the call is familiar with the Posse Foundation, but it's an amazing organization that was founded to really support underrepresented students to achieve their dreams of going to university. And it's an amazing story. I really encourage everyone to check out Posse. But they just helped us and facilitated an anti-racism training and initiative. But at the same time, we have Tony Coles, our CEO. He is leaning into the topic of race and the disparities in terms of opportunities for Black scientists, Black people in industry. He's been on CNBC, part of a panel. He's highlighted the Posse Foundation, but we also have folks from the bottom up, right? It's not a top-down environment. We also have people in the rank and file, guys like me on the front line who are committed to this. And because to say that we're doing it right and that we're doing all we can, I would say we probably aren't, but we're putting one step in front of the other. And that's why this relationship with BIN is so important, because we have to start somewhere. And I think that we're maybe a little bit further on down the road than others, but that doesn't mean we stop. I mean, we are, again, committed to doing this day in and day out. We live by these values. And so that's where I really think we need to see how this evolves. I mean, think of think about, Shane, you and I have known each other for 3 months. We've already accomplished some things. Imagine if we go 6 months, a year, 5 years down the road. Maybe hopefully I won't be the only one presenting about opportunities. But I think the change is coming, and this is our generation's work, right? People have worked hard to get us to where we are, but it's our responsibility now to take that mantle and move the dial forward.
Sure, thank you. So I do see a few more questions in the chat, so we'll probably try and get through those. So, so there's a specific one here from Delcora, which says, what are some of the avenues one can explore to gain employment in industry with a master's in translational medicine? So I guess I'd probably make it more Cerevel based. Do you know anyone who's in translational medicine who has made the switch to Cerevel specifically?
You know, I'm thinking about translational medicine. You know, we're definitely hiring in this area. And I would definitely be interested in chatting with this individual offline. I mean, it's again, I feel like this is a pioneering space where anything is possible. What is the toughest thing to do is to put yourself out there, right? I mean, interviewing is I interview people all the time, but I'll tell you, I'm probably one of the world's worst interviewers. So I would just say, keep swinging, reach out to folks. Just let them know your level of interest. Start the conversation. Don't be deterred if you're not getting, offers from the jump. You know, just keep going, because again, this speaks to the resiliency component, where you're not always going to get the W on your first go ahead. But I would say what you want to do is just get a conversation. Ask folks, tell them, hey, I'm interested in making this transition. Do you have 10 minutes to chat about, what it would take? What's some advice? And most folks in this industry are more than happy to chat, because we want people in the space helping us put our collective brain power into solutions that really make a difference for people.
Definitely. That's a great answer. So I'm looking a bit further into the chat. It's talking about, there's a question here from Dwayne, which says, how does Cerebelle feel about collaborating with academics? And the question is, a follow-up is this common practice at the moment? Yeah,
definitely. We are all about collaboration. I mean, internally, externally. Admittedly, if you think about startup world, usually there's a company that has an asset, right? And that's kind of early stage, and you're building up funding and you're trying to move the dial for this one particular asset. In Cerevel's situation, we have 11. So we need all the help we can get. Like I mentioned, we have 150 people. We need to get moving in terms of adding folks to our employee population. So I know there's a lot of collaboration. Are we doing it specifically with academia at this point? Maybe with some of our earlier stage assets, we are, but we've got our hands full in terms of really trying to move the assets that we do have forward. Did that make sense? I can get rambling a bit.
No, it made perfect sense to me, and Dwayne said it made sense to her as well. So next question.
If I may,
Sure.
the whole point of this exercise really is the fact that almost all of our scientists started in academia, right? That's where you get your basic training, or if you're in a postdoc, right, you can get that really intensive training, or an MD, right? Mm-hmm. So we are definitely pro academia, get the training, And if you want to translate that training into drug development and really take the corner in terms of the theoretical perspective and then a real life solution, it's an amazing journey and so rewarding from a personal standpoint to a global standpoint, right?
Mm-hmm.
If we can hit on a schizophrenia solution or a solve for Parkinson's, I mean, I think everybody in our company, everybody in the CNS community will feel awfully proud to be part of that.
Most definitely. So yeah, got one from Nikki, who has talked about like what are the key or desirable attributes would you say would differentiate, say, postdocs with or without industry experience? So some of us are encouraged during our PhD to actually get industry experience or to do an internship or that sort of thing. So what would you say are the attributes that, I guess it could be from those experiences, that kind of differentiate people then that you really look for when you're hiring?
Yeah, I think in terms of a postdoc, I mean, the idea is when we see your rise through the academic ranks, you're at a postdoc for a number of years. That demonstrates that you have really maxed out the potential to learn about whichever subject you're passionate about and are studying, and then the publications that come with that experience, right? So, you know, a 3-4 year postdoc really sends a signal to future employers that you're on the right track.
Definitely, thank you. So
hello everyone.
Hi Sean. So we
hello.
just got Sean who's just joining us. So Sean, I'm going to give you a few minutes just to get ready and prepare yourself with regards to the presentation that you have. So just going to knock off a few of the questions that we have in the chat and just finish them up. Isaac's doing a great job. Kind of put him in the hot seat today. But yeah, so the next question I'm going to do, and I'm going to give you sharing permission, Sean, is can you describe a day in the life of industry scientists at Cerevel? Also, like what sort of scientific skills, say, is it like coding or is it molecular work? So what are the sort of things that you're looking for?
Yeah, I can take this question. So, so everyone, hi. I apologize. I meant to get on at 2 o'clock right on dot, but running industry business sometimes means things just simply pop up and urgent and need to attend. I don't have any formal slides. I think this is, you know, slides are in this kind of environment might not be necessarily all that useful. I think what you guys really want to know is the real experience working in the industry. How does that feel like, right? So for example, the question that you just asked, do we have that question up in the chat just so that I make sure I'm answering the correct question?
Yeah, so it will be there, but I think as you join, you may not see it directly. So I can repeat it to you if you want.
Okay,
so
yes.
It's, can you describe a day in the life of an industry scientist at Cerevel? So what sort of scientific skills, so is it coding, molecular work, etc., are you looking?
Excellent. So, you know, when we say scientist, it's a very general term, and you know, obviously that includes many different skill sets: medicinal chemistry, biochemistry, molecular biology, you know, in vitro, in vivo, pharmacology, all of the above, right? So, but as a scientist at Cerevel, because we're a neuro company, so obviously, you know, for the drug discovery work that we do, we focus on discovering novel targets for the neurological diseases. So for us, you know, currently the areas that we work on, Parkinson's disease, apathy, schizophrenia, epilepsy, and we're also branching, you know, as we build out the company from the size as well as the capability, we're also branching into more disease modification research and treatment, such as Alzheimer, right? One of the most deadly, awful diseases. So for us, the scientists, they are essentially working in the drug discovery or preclinical space. By that, I mean, they could, their day could be, depending on what projects you work on, could be just purely in the lab, working on the bench, doing experiments, discover a novel target. Your day could also be working with, let's say, if you have the in vivo skills and the interest, your work could also be working with in vivo models. Or your day could also be, let's say, if it's more kind of a pharmacology, late stage research work, preclinical, your day actually could be only just a small percentage of time working in the lab on the bench, but spending a lot of time to work with your clinical colleagues, because you're working on a project that is closer to first in human in that clinical space. Or, if let's say your skill set and your profession, your training is more on the computational side, let's say whether it's computational biology or computational chemistry or structural biology, then your days might be spent outside of the lab and more in front of a laptop, in front of a computer, and working with different AI tools and working with different applications for that. So it really varies, and it could be very, very different depending on your training. But we at Cerevel, we really utilize all of the above.
Thank you. So I have a question here that talks about how can this person improve their resume, so become more competitive for these positions. So do you have any ideas or little tips onto what can be done specifically to attract industry recruiters?
Yes, absolutely. I think Isaac knows that the two of us have a lot of passion around this topic because in our work, in our day of life, we see so many resumes, or sometimes we call it CV. And can I just assume that so the audience are we mostly PhDs or postdocs or a combination of both, or undergraduates? Just make sure I'm addressing the correct way.
I would say from those that I know, we're mostly PhD, but there is a mix. So there is masters and undergraduate as well.
Got it. That's very helpful. So I think, how you improve your CVs, a couple of principles in my opinion, and Isaac, feel free to chime in because I know you see plenty in your share of life. So I think first of all, really do your homework and research on the job you're interested or on the company you're interested to target before you even start writing a resume or your CV. And I say that is very important because we see so many generic resumes that don't really highlight how your experience could be directly relevant to the job that I'm looking at, right? So that's why my advice number one is do your homework, research on the job first, and then pull out the highlights of this job or this company that you have already built some knowledge and already have some background and skill set you could apply, you could relate. And then, in other words, tailor your resume and your CV to that job or to that company that you're really targeting. So that's my number one recommendation. And then secondly, I think, again, for PhD and postdocs, you guys will have publications, right? Undergraduate might not, or might not be first author or senior author. So for folks who have publications, especially, first author, senior author, corresponding author, just make sure you really organize your publications by manuscript, posters, or I don't know, sometimes book chapters. the otherwise, and this is a little bit of a kind of a selfish call out. Otherwise, you know, people like Isaac and myself, when you have a mix of everything, we have to do the job to tease out, okay, which one is your full manuscript, which one is a poster, which one is kind of I don't know, could be like a internal communication you contributed or something. So I think that will be very helpful. And then also, you know, these days really like we've seen all sorts of format and I don't think format is necessarily all that critical, but it will, again, it's very important, whatever format you take, just very important to be able to describe your project that you have done. What I have seen sometimes, it's a very academic CV, almost like a bio sketch. You know, just say doing you know, XYZ in this PI's lab. And then you have a very generic department's name or very generic program name. But I have no idea. Some of the PIs are more well-known than others. But again, there's so many PIs, right? There's so many labs that you guys bring trained undergraduate, graduate in the US, outside of the US, Europe, and you can just think about thousands of schools. So to include what I call it a research summary, I mean, there are many different names for that, but essentially kind of a highlight what your project is, that will be very, very helpful, especially your first job coming out of academic to industry. The project summary is more useful than just the list a bunch of skill set at the end of your CV, right? Like, for example, yeah, I'm exaggerating this a little bit. For example, I've seen, you know, people list like PCR as one of the lab skills that they have, or cell culture. Well, cell culture, depending on, you know, if it's mammalian cell culture, actually it's more complicated, as you guys know. But PCR is a very, very, very entry-level standard. I mean, if you work in the lab, it's, you know, especially like if you have a molecular biology degree, let's say, you know, for PhD, you know, 5 years PhD, 3 years postdoc, I certainly hope you know what PCR is, right? So you can see that in that kind of a overly simplified or maybe exaggerated example, just simply list just some basic lab skills don't necessarily help us understand who you are, what you're capable of doing, and what is your scientific mind.
Perfect, thank you. Oh, so Tia's got a follow-up directly to that.
Okay, let's do that.
So, do you want me,
okay, so asking, so the question, what are you looking for in the publication? Number of first author papers, total pubs, journals, impact factors. It's really a little bit all of the above. I mean, there isn't and I think this is the same for other companies, you know, for Cerevel or other companies, I would say there isn't necessarily a specified number that you have to have. Total of 5 papers, one of them has to be first author, and then, you know, you have to list your impact factors, because I can tell you that it just so happened that Isaac and I are very familiar with this and we know the impact factors, but I can tell you a lot of the corporate recruiters don't know what impact factors is. They know the journals, but they don't know what the impact factors are. So not necessarily to that level of detail, but I think what we're all looking for is kind of holistically have a general sense, have you published, right? Because for PhDs and postdocs, this is different from industry. When you get into industry, you start to work on specific projects and programs. But when you're in school, going through your PhD program, doing your postdoc, your publication is your job, right? So that's why we want to see what have you published and you know, what's the publication, because essentially we want to know what did you do for your job during those 5 years of PhD or 3 years of postdoc. That's really just the main purpose. But there isn't a specified number like it has to be this, because we also know that there are also so many stories going to publication, why you can have a publication or why you can't. And, you know, the journal review and the famous level of your PI sometimes, right? So all of that. So that's why we're not saying like, okay, if you have one paper, then definitely you're not as good as the other applicants who's got 2 papers. It's not kind of that direct comparison that way.
Perfect, thank you. So we have another question which talks specifically about what skills and or experience are you looking for in clinical trial leads in industry?
Clinical trial leads. Okay, that's a great question. So I'm gonna say clinical trial. I assume you guys are kind of referring to not the medical director, not the MD track, right? Because then it's different. So we basically will have 2 types of clinical positions. One type of clinical position is, essentially like medical directors. Those are people who design clinical trials, and you have to have an MD credential, and that's just by regulation. Only MDs could sign off on certain protocols because you're doing clinical trials on human beings, right? So that's one track. So I assume we're talking about the non-MD track. Right, so in that case, whether you have a PhD or whether you have a PharmD or sometimes, undergraduate degree, you could actually just, through your experience, through your work, gradually get into a clinical space. I would say it would be difficult to become, I saw a question, managers, project managers. Okay, so I think it will be difficult to become a clinical lead right away, straight from academic, especially if you're not an MD, you don't have the clinical, the clinic space experience, right? So if you only have an MD, if you only have a PhD, not an MD, or if you have a bachelor degree or master degree and have only had research experience in academic, it would be extremely challenging to just say, I want to work in the clinical space because you don't have any knowledge of the clinical space. However, I do have experience, and I do see a lot of people moving to the clinical space gradually. For example, I've seen PhD scientists that the initial several years they work in the research discovery organizations, non-clinical space. But as they work on projects and as their projects move closer to the clinical space, or sometimes cross the what we call the phase 1 and actually start phase 1 clinical trials, they start to work with their clinical colleagues. And through that kind of a transition, they will gain more clinical knowledge, and then gradually they essentially move their career onto that clinical track. And as a matter of fact, Isaac actually is currently working on some of these what we call, clinical scientists. These are non-MDs working on clinical development programs at Cerevel. So that's one. Or I also have seen people just moved from a technical track to project and program management. So they no longer work on the lab, but they become a program manager or project manager of our research or preclinical projects, and then gradually move from that to a clinical space program manager or project manager. That's also very common. Or I have also seen, these tend to happen more on the undergraduate level. So whether you have a bachelor degree or let's say a master degree, straight out of school, some of the what we call clinical research organizations, CRO, they tend to hire quite a bit of these bachelor degree, master degree, fresh out of academic environment people into what they call clinical trial associates. So these are the entry level that you literally, you're doing a lot of the groundwork for clinical trials, enrollment, site registrations, or simply, you know, organizing what we call lot numbers, meaning which lot of dosing is being used with which cohort of patients. So those clinical trial associates, often it's abbreviated as CTA, those tend to be available, you know, right after school with those research, we call it CRO, contract research organizations, which actually provide a very good training group, training ground. And then very often people kind of move from those clinical research companies to in-house to a what we call sponsor side, meaning a company such as Cerevel. We at Cerevel, we for the clinical operation people, we actually have some, you know, fairly senior level. We call them clinical program lead. Those are typically, you know, people with 10, 15 years of clinical operation experience. But those people, they started from their CTA career day one with those CRO, you know, research, contract research organizations.
Perfect, thank you. So we have another question here which talks specifically about once you land an in-person interview. So I guess what are the tips that you would give someone who's giving a seminar, or they have to do like a one-to-one interview once they
yeah get. Good. So so Isaac knows exactly why I'm smiling, because at Cerevel, we for all the scientific positions as well as clinical positions, we do one-on-one interviews, but we, on top of that, we always ask our candidates to give a seminar. So if you already land an in-person interview, and if that company, such as Cerevel, ask you to give a seminar, congratulations. You know, consider that companies probably like Cerevel, that we really care the rigor of our hiring. It's not just an extra step. Like when I ask candidates to give a seminar, it's not just because it's a process, I want to add an extra step, but really is, you know, you guys need to understand the reason that we ask for a seminar is because we want to see how you think as a scientist, right? Through your description of your project, whatever you want to present. To a certain degree, the content is not even as important, because whatever project you present, that's not going to be the project that you'll be working on when you come into Cerevel. And plus, projects, they come and go, right? Not every project will move forward, and otherwise drug development will be way too easy. So in a sense, it's not necessarily like the content, but we want to understand, okay, if you're presenting an experiment that I did, then we want to understand, why are you doing this experiment? How are you designing it? What questions you're trying to answer? And then how do you analyze your own data? And what did you learn from this experiment? And also what are some of the insights as that you will gain as your, let's say, your next follow-up, right? So we want to catch a glimpse of your scientific mind, who you are as a scientist. So that's one, that's very important. That's why we ask you to give a seminar. And secondly, we also want to see, you know, your scientific communication skill, meaning how do you present data? Do you communicate clearly? Because it's going to be a group setting. Even now, you know, when we do this virtual seminar, it's still a group setting that all of us can view your seminar, attend, and then all of us could ask you a question about that, right? So we want to see, can you present, communicate clearly? How do you manage the audience, right? And then, you know, can you think on your feet? Because you have no idea what questions we might ask about your project, right? So those are the reasons why we ask for a seminar. Once you know the reason, I think then you could think about how you should prepare a seminar. Right, so I think, you know, minimally, I think guys can probably guess that you need to pick a interesting scientific story that you can tell the story, and then also, you know, again, that because this is something that we want to understand how you think as a scientist. So you know, be mindful of the story that you want to tell, because you want to be mindful of how you come across as a presenter, right? So for example, if you know this entire seminar is only 30 minutes or 45 minutes, don't come in with like 90 slides, right? So that's how I would give a recommendation for seminar. One-on-one interviews, you know, be the authentic self. That's actually something that we ask for at Cerevel is, you know, I always tell candidates, yes, you're interviewing for this job, but when you come in to interview with me, first of all, I'm interested who you are as a human being. That to me, I think to Cerevel, that is in a sense above the job, what the job is. I'm interviewing you for this job. So of course, what your scientific capability does matter, because when you don't have that capability, you can't do the job. But I would say who you are as a human being, as a person. Do you fit with what we believe in, our value system? I would say that's actually more important than your skill sets, because no one would know everything in the world. So it, you know, you can learn the skill sets, you can learn. We can teach you, we can train you, you can learn. But if you as a person, your value system is not aligned with our value system, that's going to be very difficult to train. You're not going to be happy. We're not going to be happy. So that's why I think, you know, number one, just be the authentic self. But the second tip is, you know, precisely as I just mentioned about the culture and value system. Do your homework, minimally go to the company's website to see what they, because most companies nowadays have their culture statement, have their vision statement. See what words they pick, right? Like for example, Cerevel, we have 5 core elements in our culture. The first one is trust. That's the first and the most fundamentally important word in our culture. That means for us, we value trust above everything and anything, and we want our colleagues to trust each other. We want to trust our colleague. We want to build kind of an environment that believe we will all come in with the best intention, because we all want to develop a drug for the patients. We might have different background, we might have different ways of doing things, but trust that we all come with that intention, right? So I think that's another thing is before your one-on-one interview, do your homework about the company. I think that also will help you kind of think through how you want to talk to them. And of course, the third thing is, you know, more specifically is definitely do your homework on the interview team, you know, who they are, right? Minimally do your LinkedIn, Google search. And if it's a technical interview, and you might want to pull out that person's publication record just so that you know what that person had done before. So definitely do your homework. And coming with good questions. Yeah, I can tell you that Isaac and I, we've also run several interview training workshops. Nothing is more kind of, what's the word I'm looking for? Underwhelming when you ask a candidate, you know, do you have any question? And the candidate says, no, I don't have any question. And we all know that it can be you already have everything figured out. Right? So I would say always prepare to have, and this is obviously based on your homework. Or if you don't do your homework, you wouldn't have a question. So do your homework, prepare your questions, whether it's for the company or for that individual interviewer. Just be thoughtful about the questions that you want to ask. Because that's actually, you know, honestly, that's your opinion to interview a Cerevel as well, right? To see if Cerevel is the company you want to work for, if we are the colleagues you want to be hanging out with. So you should, for your own sake, you should also think about good questions to interview us and see what we say to your questions. Are you satisfied with our answers? Do you want to be hanging out with us? Does that help? Yeah.
Yeah, that was a great answer. So there's another question about the variety of contracts. So whether a position is full-time, is it part-time, is it long-term, short-term contracts?
Yeah.
So it's like what?
We have Well, I think in outside of US, there are more different, type of contracts or we call it offers. But for us, mostly is full-time employees, so we call them FTEs. And sometimes we utilize what we call contractors. That means they're not our full-time employees, and we hire them on a temporary basis, either to help out a big project, or let's say if someone is on leave, I need to find someone temporarily to hold that person's job, to do that person's work. So that could be anywhere from as short as 3 months of a contract, as long as sometimes could be a year of a contract. So those are the really, what in the US what we call is temporary workers, because they're not full-time and they don't have Cerevel's benefits and type of package. So they're generally paid hourly. Cerevel right now, we don't have a part-time employee, but I know some of the large companies might have part-time employees, meaning they're still the official employee of the company, but they only work part-time, let's say 20 hours per week or 25 hours per week instead of the 40 hours per week work schedule.
Perfect, thank you. So there's another question which talks about, you mentioned that people start in R&D positions and then essentially move to managerial positions later on. So I guess the question is can you speak a bit more to that transition, and are there opportunities to kind of move in terms of your career trajectory?
Good. Excellent question. I love to see how people are already thinking far about their career development. So in Cerevel, and I think also this is same for a lot of the biotech company, life science companies. But typically, for R&D, we have the research type of, we call them the research track positions. We have management track positions. The R&D positions, a lot of those are research track. We call them individual contributor, meaning they are, they can get scientifically very high level, very senior level, scientifically, technically, but they might not manage a group of people. They might not manage a function. So, so by that, they are quote unquote the individual contributors. The management typically is when you have a group of people to manage, when you have a function to manage, and so you could be title-wise, you could be director, senior director, vice presidents, and what have you. So this, how do you grow to management? It's a little bit of both the business as well as your individual performance and interest. And the reason I said a little bit of the business is the business has to have the structure, have to have the size, to have, let's say, a team for you to manage, right? If it's a very small function, there are only 2 people, you're not going to have a team to manage. So I think that's why, that's one thing, it's the scope and the structure of the company. And for example, at Cerevel, our senior level scientists, they're a little bit dual track, meaning they are the scientific leaders. Like for example, we have, a head of in vivo pharmacology. That person leads scientifically. She actually managed all our in vivo pharmacology functions. And she is a PhD scientist herself. So that's the scientific leadership. But her dual role is also that she now also has expanded her lab. So she has hired junior scientists. She has hired research associates. She has hired technicians. So now her lab has a group of 4 people, going soon to be 5. So then she's also essentially the head of that lab, right? So she also has that management responsibilities. And this is how you, typically in the R&D space, this is how you grow, become a management track.
Perfect, thank you. So I think that's answered every question I've seen come out in the chat. I guess just generally, Sean, I'm going to ask you as someone who's working at Cerevel. I think it's just important to really just get that passion out from you. Why would you choose Cerevel over another company, or encourage those who are here in the chat to choose this company to potentially work at?
Yeah, so this I love this question because I am so passionate about this company, and anytime when someone asks me this question, I could go on and on. So feel free to cut me off, Shane, because I could just keep talking. So Cerevel is we are such an interesting company. Why I chose this company, it's very interesting. So several factors. You know, my background, for folks who don't know me, I had always worked in large companies. And this is the first time I've actually worked at a small company, a small biotech startup. Actually, same with Isaac. We shared many common companies previously. So for me, the first thing is the pipeline. We have a very interesting and also very extensive pipeline for the size of our company, as well as for the tenure of our company. So we're actually only 3 years old, not quite 3 years yet, a little bit under 3 years old. So it's tiny when you think about, you know, we're 2.5 years old. But our pipeline, we already have, 11 assets and then 8 clinical trials. So half our assets are already in the clinical space. We have a very diverse neuroscience therapeutic areas. So Parkinson's, I mentioned Parkinson's, epilepsy, schizophrenia. And especially if you think about schizophrenia, right? Last time there's any meaningful treatment was almost 20 years ago that got to the market. So this is a highly, highly unmet medical need for patients as well as their family members, caregivers. So the pipeline that we have such a robust pipeline and so promising and already in the clinical stage, it's not like, you know, way early in preclinical and who knows if it's going to make in the clinic. We already have some very promising, you know, data readout in our clinical studies. So to me, this is super exciting. Selfishly speaking, I could see some treatment be out in patients' hands in relatively short amount of time, could be just, you know, a few years, right? So that's one thing. When I look at this pipeline, a couple of years ago when Cerevel called me and said, do you want to join us? That was one thing. And the second reason is because of such pipeline, we're very uniquely positioned. So 2 years ago, when the company was trying to recruit me to join, I realized because of this unique pipeline and how strong the pipeline is, we were able to attract a group of very seasoned senior leaders. So these are what we call our C-suites, right? Our CSO, our CMO, and including our CEO, Tony Coles, and Abe Cisse, who many of you guys actually saw as our president. So these are a group extremely experienced drug developer, and they have all launched drugs under their belt. And a typical startup probably will not garner their attention, but because we're not your typical startup, because of our pipeline, the quality of the assets and also where the pipeline is and the extensiveness of the pipeline, they decided to join Cerevel. So that was my second reason, is to work with such group of top caliber drug developer, commercial leaders, and also our CEO, Tony Coles, 4-time CEO, such a reputation on the street, right? To me, that's amazing to work with such a high caliber leadership team where I could also learn, selfishly speaking, working with them so closely, I could learn. So that was another reason that I thought, oh my God, this is such an amazing experience if I can join this company. And the third reason is a little bit to my own function that Isaac knows, that I had always been at a large company, and the talent acquisition function was already built, right? So Isaac and I, we will be joining that talent acquisition function to support a piece of it or to lead a piece of it. But that department, that function at large company, that was way built before I joined the company. Oops, sorry. But Cerevel, this job, because we are uniquely positioned, because we are still a startup, I got the opportunity, I got the chance to build out this function together with the company from ground zero. So I was the first one and the only employee for talent acquisition when I joined Cerevel. And then I brought in Isaac. So it's bit by bit, right? But that to me is, I thought it would be such an experience to build something from ground zero, to experience that startup excitement. And if I would say also a fourth reason a little bit is really the financial backing and the financial stability. That Cerevel, let's face it, nowadays everything takes money, right? Same thing with growing a company, develop drugs. As you guys know, drug development is super, super expensive. So if you don't have a secure, strong financial backing, you don't have enough money to develop a drug. Clinical trials are extremely costly. Just one phase 3 global trial average cost will be somewhere, $600 million or more, right? So if you don't have $600 million, guess what? You can't do a phase 3. But Cerevel is financially in a very secure space. We raised additional fund when we became a publicly traded company 10 months ago. And then since then, because of our positive data readout, we raised additional funds. So we actually had a couple of rounds additionally to what we raised back last October when we became public. So that also made me feel that, okay, I will have a job that is securely financially supported by our funding, that we could actually move these programs, projects forward with that funding. So all of those reasons combined, and I would have to say, and Isaac, feel free to chime in, I would have to say the past 2 years, and I actually, Isaac, you're just marking your 2 years, so happy anniversary.
Thanks, boss.
So I would say the past 2 years at Cerevel, really, really just amazing. Like, sometimes I feel like I just joined the company 2 months ago. Sometimes I feel like I've been here for 10 years. Just thinking about the amount of growth that we have done, not just the size and number of people, but how much work we have done to move our clinical pipeline forward. When we established the company 2.5 years ago, we had 5 clinical programs initially, and now we have 8. The company grew from, I think when I joined the company, I was employee number 20, and now we have 150 employees, and we should end this year with a little over 200 employees. So I actually kind of, when I look back the 2 years, I feel like I can't even find the word to describe that experience.
Sean, let me jump in here real quick too, because I think
Please.
You mentioned it earlier. I mean, in terms of our leadership, and Tony and Abe and everybody else in our C-suite, our chiefs, their commitment to doing the right thing, leaning into challenges, right? Shane, when you and I chatted initially, you told me BIN was really in response to George Floyd and all of these other issues that need to be addressed, that we need to grow as a country, as the world needs to grow in terms of equity. And Tony just leaned absolutely 100% into this issue, and he's put the onus on us, right, to educate ourselves, specifically the non-Black employee, to go out and figure out how to deal with these issues and make change within our own community. So we had these really difficult, what have been historically traumatizing conversations, right? Or dealing with the trauma of that event and numerous others that we've just continued to see. But Tony just brought us all together. We had open and honest dialogue and trying to, again, take our words and put them into actions. And in a way that Sean and I have been in the industry for decades.
I know. We're old.
We're old. But the idea that we have a CEO, a leader who's having these conversations in an open forum where it didn't matter if you were an executive assistant or a VP, there was a dialogue occurring. It didn't matter if you were Chinese or Black or white, you were part of the conversation. And that is, for me, was such a, like, I was emotional about it for weeks. Sean knows I'm an emotional guy, but, and we've both worked for great companies in the past, but I'd be hard pressed to say that this level of intimate conversation and meaningful dialogue is occurring at any of our former companies. So when I think about Cerevel, I think about that, just the willingness and almost an eagerness to lean into any issue, no matter how big or how small. Let's talk about it. Let's work on a solution together and let's move forward.
Absolutely. Very well said. Thank you, Isaac. So I think that I hope I shared with you guys a little bit of why I joined this company. Sometimes I joke with my own boss, saying, okay, let me see what I want to do after Cerebelle. And I get the stare like, what? You're already thinking about after Cerebelle? But I mean, that's, we work very closely, so we joke all the time. But really what sometimes when I think about, like, really after Cerebelle, I don't know. I don't know. I can't, let's put this way. If I'm going to go somewhere after my Cerebelle career, I don't think I can go back to another large company. Just the fun, the excitement, and the transparency, and how genuine everyone is. And even this day that I've been in my role for a little bit over 2 years here at Cerevel, I'm still making things up. Might not be on a daily basis, but certainly on a weekly basis, I'm still making things up. So I love it here, how this company give me the runway and the space and room to grow, to be creative, to essentially work with everyone, get something done, get something out there to the patients. That's amazing. I can't wait. So our leading asset, I don't know if you guys know, look at our website. Our leading asset, tavapadon, is a phase 3, currently is in global trial phase 3. And that is a Parkinson's disease for that treatment. So we are in the middle of phase 3, and we hope we do everything right. And if we do everything right with a little bit luck, we could potentially launch a new drug in 2-3 years time, a new treatment for Parkinson, especially early onset Parkinson's disease. That just gives me the chill to, like, okay, in just not that far out, that I could tell my friends and say, hey, we just launched a new drug and this is for Parkinson's disease patients. That, like, even now it's like the hair on on the back of my neck stood up. It was just like amazing experience. So for that, I don't think I'm going anywhere anytime soon.
I love the answer. Thank you. So we've got 2 questions, and we'll probably make these the 2 final ones. So the first one here, which is in the chat, is as a follow-up to what was previously mentioned about management,
Yeah.
would an MBA or master's in project management, in addition to PhD, be beneficial?
So I think, that's a great question. So I think it kind of depends on where you want to grow your career. I would say a MBA would definitely be very helpful if you think you want to grow your career more towards the business side, or the commercial side, right? So business development, corporate strategy, commercial marketing, those kind of a space. I think an MBA will be very helpful, and quite frankly, quite impressive if you can have a technical background with your PhD study and then an MBA background with the business acumen. That'll be very good. But if you think more of as a program, a head of program management, or what sometimes we call it portfolio management, then a MBA will still be very helpful, but then a project management certificate or what have you could also help you. But I would still say that overall, when you go into that management, it's not like you have to have an MBA or if you have to have a project management certificate. It's not really a must, but I would say the MBA will be helpful if you are moving into kind of a more business related direction. I also see a question for intern. We do actually. So Isaac, you can speak about our intern program, and then hopefully next year we will continue to expand and grow our intern program.
Yeah, I mentioned this before you jumped on, Sean, but we did, successfully launch our inaugural summer internship program. The feedback has been fantastic. We have a couple of members from BIN who are participating, and they just are gushing about their experience. And so we're looking to build on this. We wanted to have 6 interns, I think, initially, and we ended up taking 9 based on the interest level, which was fantastic. We're committed to this. We want to do this year over year. And again, I think it speaks to our commitment and our culture that we're 2.5 years old and we're already ramping up, thinking about the next generation of neuroscientists. So yeah, I'm happy to chat with anyone, an undergrad who is interested in next year's internship. We can definitely chat.
Definitely. And I would also say a very practical tip is we will, because these are summer internship slots, so we will post those positions very early. I would say, Isaac, would you say late January? Late January, early February, we should be posting those positions.
Yeah, absolutely.
Yeah. So if you're interested in participating in an undergraduate internship program for us next summer, then start paying attention to our website like mid to late January. That's when we will be posting our summer internship positions.
Mm-hmm. And we also partner with a group called Handshake, which has a sort of a centralized, I think this was brought up in Abe's discussion earlier, but
got it.
Folks were asking about a centralized sort of repository for internships that may be available. So if folks want to look at Handshake for opportunities, again, we're pitching Cerevel, sharing Cerevel stories, but we also want to be a resource that there's tons of opportunities, and sometimes it just takes being aware of them to capitalize on them, right? I mean, it's half the battle.
Thank you. So, and there is one final question in the chat, and then we will close out. So the question is from Tia, and it says, are there spaces at Cerevel for non-PhD clinical trial project management for those with experience in clinical trials? So it's phase 2 and phase 3.
So let me make sure I understand this question. So is this question asking whether we hire people without a PhD degree, but with clinical trial experience to be our clinical trial project management roles. Is that, do I understand that correctly?
Yeah.
Oh yes, yes. Actually, you know, that's what we call the clinical trial leads. You know, those are the opportunities in our clinical operation space. So I'm not sure if that's what you meant, but those are the individuals, the high level individuals who would manage and lead our clinical trial operation programs. So they're called clinical trial leads. And most of them actually don't have a PhD. Like those are the people that, as I mentioned earlier, started with their career as a CTA, clinical trial associate, and then moved their way into more seasoned clinical operation and clinical trial lead. So we call them CTL, clinical trial leads. So that's one. But if you're kind of referring to just the clinical program management, yes. So on the program management and portfolio track, we do have non-PhDs. It doesn't require a PhD degree, but experience in managing a clinical program. That is more than just clinical trials, but really managing an asset from all aspects: the clinical piece, the scientific piece, the manufacturing piece, the future commercial relevance. So that is a much bigger role in terms of overall project management, or actually we should call it program management.
Thank you. So I think that is all our questions for today. I will give it back to Sean and Isaac just very quickly. If you have any final words directly for anyone that's here or within this session. But if not, I just want to say a huge thank you for taking the time to actually come out and to represent Cerevel, but also your commitment. And we've seen that over the past few months in having these conversations and really looking to recruit talent, and specifically recruit Black talent too. So I'll give you the floor for one, any final comments that you may have, but if not, thank you so much.
Yeah, no, first of all, you know, Isaac and I myself, we love this group, love this venue. We are so appreciative, and thank you for inviting us to give us an opportunity to talk about our company Cerevel, but also to share, you know, our professional experience, our personal journeys with this group of people. Thank you. I would just say, you know, Cerevel is a very interesting company, but more importantly, I'm so thrilled to see so many of you guys continue in this scientific space, whether you want to engage in a discovery research lab space, or, you know, perhaps clinical or project management or even business space, as I'm hearing some of the interest. Neuroscience is an amazing space. So whatever function that you will grow and stay, continue your effort. I think neurology is such an amazing and challenging and difficult space. We need more talents, and we need more breakthrough in this neuroscience space. And people that now they say, you know, neurology is like the oncology 30 years ago, right? Meaning oncology, you know, by no means we have figured it out, but in the past 30 years, the oncology space has made so much progress, but not the neurology space. When you think about treatment, when you think about, you know, medicines for patients. So I really hope that everyone right now on the screen will continue working in this space, and in whatever capacity, let's push the frontier.
Absolutely. I would just want to echo Sean's comments, and just, I'm so humbled and grateful to be part of this conversation today, to be partnering with BIN. Really appreciate all the work that the interpreter, Du Bois, is doing, and the captioner. And what I want to say is this is just the beginning. It's just the beginning of this conversation between BIN and Cerevel. It's maybe just the beginning of the participants' career in discovering opportunities in biotech, and hopefully at Cerevel at some point. But really the commitment that we all should share is to stay in contact, follow each other's careers, help each other out, and move the dial so we can achieve all the goals and dreams that we have for CNS. And again, just to the BIN team, thank you so much. And I look forward to chatting with all of you before next year, but hopefully again next year. I think we should be in contact but in between too. So thanks so much.
Absolutely. I am more than happy to be your mentor, to be your sounding board, you know, all from my experience. You know, you guys have a bright future, very, very impressive, really. Thank you.
Thank you so much. So with that, I say thank you again to our conference sponsors. Big thank you to our live captioner and sign language interpreter. For the most up-to-date information on the conference, please check out the conference booklet on our website. And we're going to continue the conversation with Black in Neuro careers via the hashtag on social media. And we hope that you enjoy the rest of the events that we have for this week. So that closes out our session. Thank you.
Thank you, everyone.